Hi, I am here with board-certified plastic surgeon Dr. Andrea Martin, and we're going to deep dive into all things liposuction. So Dr. Martin, thank you so much for taking the time to chat with me.
Of course, thank you for having me.
Oh, my pleasure, completely. So liposuction, what is liposuction? Let's just start there.
Yeah, so liposuction is basically just removing stubborn fat from an area of the body or multiple areas of the body. It's a really good procedure for patients who are normal or roughly normal weight, have a very stable weight, but just have those target problem areas that they can't get rid of.
I totally understand. Are there certain areas of the body that are best for liposuction, or where can liposuction be performed? Like, where can we take fat from?
You can take fat from a lot of places. Most commonly, patients are coming in abdomen, their love handle areas, the thighs, and the arms.
So can you maybe walk us through like what's involved in the procedure? Like,
Yeah,
what does that look like?
Of course. So with the procedure, it can be done awake or asleep, depending on a lot of different factors that you would talk to your surgeon about in your consultation. The next part is we put fluid in. That fluid in helps numb up the areas. Even when you're under general anesthesia, you need some numbing, as well as it helps the blood vessels clamp down to limit the amount of bleeding, and it helps loosen up some of the fat to make it easier to remove. So once all the fluid's put in, we wait a certain amount of time, and then we remove the fat with something called a cannula. Something like this. There are different sizes, lengths. It's hooked up to a suction tube, and you just move it back and forth, and the fat comes right out.
So is there scarring then after liposuction, would you say?
There are little tiny scars, less than a centimeter, that will be sutured closed, and they heal well. They're almost imperceptible after they've completely healed.
Wow. So then what does the recovery time look like with liposuction?
That's really dependent on which area you're having done and how much you're having done all at one time, but the recovery is a lot easier than what people expect often. Usually at about 2 weeks, you're able to get up and do anything you want. That includes vigorous exercise. The most important thing during the recovery is you have to wear a compression garment for at least 4 to 6 weeks, depending on the area. But most patients are ready to go back to work within a couple days.
Wow. So can you combine liposuction with other procedures, or is it like a standalone, you can only do liposuction?
Oh, definitely. I encourage patients to combine it with other procedures. It combines really well with a number of different things, especially mommy makeovers, tummy tucks, breast reductions, to get that target that bra roll fat area. It goes well with anything almost.
And is there something that people should be aware of to prepare for the procedure to have the most successful outcomes?
The best patient for liposuction, like I said, is at a stable weight, something they can maintain, and as close to a normal weight as possible.
Okay, so a consistent, steady weight, would you say for 6 months?
Yeah, 6 months.
6 months is good, wonderful. And then is there a certain amount of fat that can be removed? Are there only a certain amount of areas that can be performed at the same time, or can you do multiple areas too as well with liposuction?
There are limits to how much lidocaine, the numbing medicine that we can use, so that sometimes can limit how much you can have done at one time or how many areas we can do at one time. And there is also a limit for how much fat can be removed at one time, so that limit is 5 liters. Most of the time patients coming in aren't even going to achieve that. So most of the time patients can get what they need in one fell swoop.
Wow. So is it a weight loss treatment as well?
It is not a good weight loss treatment.
Okay.
You may see a slight change on the scale, but that would be months into your recovery, and you probably won't notice a difference. It is not meant for weight loss. It is meant to change the shape and target those trouble areas.
Wow. So when will people see their full results? So if they're planning for a wedding, a vacation, a trip, how far out before that deadline should they have the procedure?
I'd say a minimum of 6 months, preferably at least a year.
Yeah, so it takes a full year for recovery, but they will be in a good place around the 6-month mark?
Yes, yeah.
Wonderful. Is liposuction right for you? I don't know. Give us a call, find out. Come meet Dr. Martin, have a consultation. We'll create a customized treatment plan and let you know exactly what's involved for you to reach your goals.